I'm Dr. Vandana Sood, and I'm a family physician with years of experience dealing with ladies and children.
So, Vandana, so there is this thing about GST being levied on sanitary napkins. So, as we know, and from many surveys, we've understood that a lot of women, especially in the rural areas, are not accessible to sanitary napkins. So, how important is it to make sanitary napkins accessible to more women?
See, our country already has a lot of taboos about menstruation. Okay, women are segregated, women are not given proper hygiene, women are not given proper food, women are not given proper care during menstruation because there are a lot of taboos attached with it. We encourage women to use sanitary napkins. We encourage women to use a proper menstrual hygiene method because if they do not do it, they are prone to infections. You can start with simple infections like fungal infections, a lady.
And also, if I look at surveys, there have been cases where women have contracted life-threatening diseases, and that has also caused
Right.
death.
Yeah, that's what I was trying to tell you. See, infection can be a simple fungal infection. It can be something which you call a pelvic inflammatory disease, which can be either acute or chronic. Okay, this requires hospitalization. This requires treatment. This can be life-threatening. Even surveys have been done in which a long pelvic inflammatory disease can lead to cancers. Cervical cancer is the leading cause of death in our women. Cervical cancer in India affects about, we say around 72,000 women per year approximately. We are 1/4 of the women dying of cervical cancer in our country. Okay, and the biggest cause of cervical cancer in our country has been found to be chronic infections. Now, chronic infections can be due to lack of hygiene. Lack of menstrual hygiene is a leading cause of infections. So, we encourage women to use safer methods of menstrual hygiene, and that includes simple sanitary napkins. Now, sanitary napkins should be available to each and every girl. Why are we talking of percentages? That's the main question.
Also, women as an alternate use ash also. So how true
Yes,
is that?
yes. That's what we see. We read of women using husk. Women. Not every woman can afford cloth. You read of women living in a village of Orissa who are managing with one sari for the whole family. So we have to make it available to these women. We have to make available simple, cheap methods of menstrual hygiene so that they are not forced to use methods like ash, husk, rice husk. Okay. Now imagine this entering the vagina of a woman. Imagine the amount of infections husk ash carries, which can be introduced through the vagina into the uterus, giving them a life-threatening infection at any time. This also causes infertility. Another thing which causes a life-threatening problem can be infertility. Now, infertility will not only go to the woman, it will also lead to a sexually transmitted disease. The sexually transmitted disease goes to the man, and this leads to loss of working time, loss of studying time. A lot of women have to drop out of school. A lot of women miss school in the 5 days or the minimum time we consider for an average. Yes. Now, Menarche starts at 10 to 15 years of age, and menopause is at between 40 and 50 years of age, right? Now, between this, imagine the number. If I lose 5 days of a month every month, imagine the number of days I'm going to miss in my lifetime. I will be dropping out of school. The girls drop out of school. They don't go to school. They're so ashamed to go to school that they do not go to school. Okay. Now, if a girl, once she stains her dress, imagine the trauma she's going to bear for the rest of her life. Right? So, giving a girl a proper menstrual hygiene is going to improve our working force, improve our studying force, improve the maternal child health. That is the thing we are more worried about.
And also, Vandana, in 2018, the budget is coming out on 1st of Feb. So, if we specifically talk about women health care, then we can say, right, that menstrual hygiene should be the first point of concern considering GST being levied on sanitary napkins. What do you have to say about that?
We as doctors will be with you for this, because any tax, there should be no tax actually.
Yeah.
A sanitary napkin should be provided free of cost. So providing GST on such an essential service,
It's not a luxury item.
it's not a luxury item, it's an essential item. Okay, you do not provide GST on essential drugs. So why should you be putting a GST on a thing which is so essential in female hygiene that it should be provided free to all women? There should be sanitary napkin dispensers in every school. The girls should be made to feel that there is no shame or taboo in going and ask. Of women almost feel that the only reason why they use cloth in an urban setting is because they cannot afford the napkins. Okay, now if these 70% of women, if I can't afford it for myself, how can I afford it for my daughter? That is the main thing. So that woman who is not using the napkin today, if I make it free for her or make it at least cheap for her, she will be able to afford it. I cannot afford a napkin of 10 rupees or 20 rupees for my daily needs. I need to change 3 to 4 napkins in a day. A woman will not only avoid buying a napkin, she will avoid changing a napkin. Now, if I don't change 3 to 4 napkins in a day, I'm leaving that napkin, a wet napkin, which again is a source of infection. So, not only am I providing a source of infection by using cloth, even by keeping a sanitary napkin, which I feel is too expensive, and using it for too long, I'm exposing myself to infection. So
not just the removal of GST, we should also consider having free sanitary
yes,
napkins.
yes. I mean, we don't even think of GST. You know, GST is something which should be put on items which are non-essential,
Optional, basically.
optional. Okay, a luxury. Why are we putting a GST on an item which is a necessity? And it is an item which is absolutely essential to maintain. See, prevention is always better than cure. If I can prevent an infection, imagine the cost I am spending on treating an infection. Imagine the cost to the nation spent on treating cancer. Imagine the cost I have to spend on a woman who's losing 5 days of her month, of her working time, of her studying time. Okay, now instead of this, if I can just provide her free sanitary napkins, imagine the cost I've saved. Imagine the trauma I have saved to that woman. Imagine the education I have given to other people, that this woman is safe, comfortable and free to come to work. She can play, she can run, she can do anything. A woman should be able to be comfortable enough to lead her daily life even during the days of a period. Why should she feel that the days of a period is something in which she's not supposed to come to school or not supposed to work? Yes, she's handicapped. Why should I handicap her? Why can't I make her free? So if I can provide free education for my girls, if I can provide free midday meals for my girls, why can't I provide free sanitary napkins for my girls? That's my question.